Welcome to Learning Unit number 4. To start off, you're going to notice that the topic is policy design. Originally, I had policy design along with financing healthcare, and we had readings in Chapter 10. We're going to cut back a little bit on those readings because of the articles that we have. So we're focusing on policy design, and then you're also continuing to work on your final document that will be, we're looking at the background of your issue as far as your policy issue. So for this week, we're going to evaluate the effects of health policy and public policy on the status of the U.S. healthcare delivery system. We're going to look at and answer in our discussion board post the question of how can nurses influence the healthcare system by engaging in health policy? How can we make a difference in the care of our patients by engaging in health policy? That's really a best way to look at it. And we're going to look through the lens of a specific issue, and that is nurse staffing ratio. So we're going to look at the research on nurse staffing ratios and how engaging in health policy for nurse staffing ratios can help to influence our healthcare delivery system and the outcomes of our patients. And in your readings, you explore the 4 pillars that form the framework for health policy. And that's the quadruple aim, which I know we've discussed in other courses: quality of care, access to care, cost of care, and the work-life balance of care providers. So there are readings in your text. I've tried to limit the pages instead of just including all the pages of Chapter 4. If you would focus on 77 to 88, and then you read the conclusion on page 93 to 94. That will give you the information that you really need for all of your work in this course on policy design. And then pages 124 to 126 that come from Chapter 6 will help us look a little bit more at federal and state policy implementation, because this is going to come up in our discussion about nurse staffing ratios. Because as we note, Linda Aiken has done a number of research articles that she has published, and you'll see further down, we'll talk about the state implementation. The only state is California that has implemented minimum nurse patient ratios, So perhaps, according to Linda Aiken, we need to look more at the federal level as far as policy. And you are going to do the discussion board post, but there is no reply required. I do ask that you complete your post by Friday evening, so that will provide you some time to work on your assignment number 3, which is the background. So you're watching this video. There is a half hour, 40-minute, audio about transforming nurse staffing and care delivery that I found very helpful, and that is the Association of Critical Care Nurses, from them. It's a podcast. And then you're going to see there's 3 Linda Aiken studies that are going to be, I'm going to ask that you review. The first was 2014. Yes, I know it's 2024, that's 10 years. So I'm not asking you to read the whole article. I've highlighted some sections in yellow that I think are helpful. But Linda Aiken is, as most of you probably know, Dr. Linda Aiken is considered a health services researcher. And that's what our author of our book calls her. And health service researchers either inform public policy by identifying problems or weigh the risks and benefits of different solutions. And they also provide estimates, oftentimes, on the cost to government and society for these solutions or lack of engaging in these solutions. So she is going to speak in her research the estimate on the cost to government and society. She really focuses on the estimate to society by how many deaths can be prevented with safe nurse staffing ratios. So try to read the highlighted section. And as you'll note in your readings, there are case studies after the conclusion on page 258. And if you have the time, it was that case study really may be one that you want to look at before reading the following articles here. If not, I understand, but it's just additional information that you might find helpful. So our first study was 10 years ago, pre-pandemic. Very important to recognize. Then we have a study that her and her fellow colleagues published in the British Medical Journal. So, I mean, she's top-notch researcher. These are her research is published in many medical journals as well as nursing. So this was a 2021 article on a research article on patient outcomes and cost savings with safe staffing. And I hope the abstract itself will entice you to read the full article. And then the most recent study that Linda Aiken, if you can only focus on certain sections, you always focus on the abstract, right? I mean, that's giving you an abstract. And then the intro, I think, is really consolidating a lot of her previous research, but that's important. The discussion you're just going to want to read. And then implications for policy, I think, will help you with your discussion board and your conclusion, and the conclusion of the article. So a key takeaway that I want you to recognize is because we're talking about the difference between state and federal health policy. And according to Dr. Aiken, given the strong headwinds from deep pocket special interests opposed to states establishing hospital minimum nurse staffing requirements, federal options should be pursued. I thought this was very interesting. And the most promising federal option is to establish minimum safe nursing staffing standards for hospitals as a condition of participation in Medicare. So I want you to think about that a little bit. If a hospital is going to be receiving Medicare funding, then there can be the requirements for establishing specific nurse staffing ratios and standards and minimum ones. So I think this is a way that we're now looking at. So I hope this article helps you complete your discussion board. No reply is required this week. I ask that you complete it by Friday evening. And as I said before, that will give you some time to really focus on your next assignment, which is the background. So coming back here, how can nurses influence the healthcare system in our country? By engaging in health policy. And I want you to specifically look at this question through the lens of nurse staffing ratios. So the final assignment is the policy change or planned policy. I'll get this right yet. Planned change policy assignment. And we're working at the third week, which is the background. So when you click on that, you're going to see that, oops, here we are. The purpose and requirements, you know that you're building on what you've done in week 2, which was identifying which issue you're going to be looking at. Now you're looking at, or that was week 2. Week 3 was you were doing a SWOT analysis and choosing a champion. This is week 4, and you're writing about the background. So let's look at the background specifically. If you click on the assignment here, let me open that up for us. And this is all just repetitive information. But remember, you're building one document. So I should see your identification of the issue information, your choosing a champion information as we go on to the background. And the background is a summarization of the background. What is the supporting evidence of your policy, planned policy change, with rationales? Just clearly stated, detailed information in relation to your policy issue was presented. And of course, professionalism includes that it's clear, organized, free from spelling, grammar, appropriate referencing per APA. So that will be, that is for week number 4, and that is actually the 3rd step in a 5-step process. So remember, your 4 different documents, or 4 different responses during the weeks 2, 3, 4, and 5 are building on one another, and with some tweaking, you will have your final planned policy change assignment completed in week 6. Thank you.